As the country enters its second week of stringent restrictions to try to stop the spread of coronavirus, there was a warning today that it could take up to 6 months before life in the UK returns to normal. Senior Medical Officer Jenny Harris said this didn't mean months of complete lockdown, but that people would have to be responsible and reduce social distancing measures gradually. The government has now confirmed that more than 200 people have died since yesterday. The vast majority of deaths are in England, with over 1,000 fatalities, followed by 48 in Wales, 41 in Scotland, and a total of 21 deaths in Northern Ireland. Our science editor David Shukman has the latest.
The stark reality of fighting coronavirus. From Roundhay Park in Leeds, one of the biggest in Europe, almost deserted, to Trafalgar Square in London, usually crowded. Evidence of social distancing in action, but we won't know how well it's working for 2 to 3 weeks. In this critically important time, the Prime Minister Boris Johnson, himself infected, has been chairing meetings while in self-isolation. And he's written a letter to be sent to 30 million homes across the UK with a stark message. It's important for me to level with you, he says. We know things will get worse before they get better. But we are making the right preparations, and the more we all follow the rules, the fewer lives will be lost and the sooner life can return to normal. But that won't come soon. The daily briefing at Number 10 made that very clear.
Over time, probably over the next 6 months, we will have a 3-week review. We will see where we're going. We need to keep that lid on, and then gradually we will be able to hopefully adjust some of the social distancing measures and gradually get us all back to normal. So I think 3 weeks for review, 2 or 3 months to see whether we've really squashed it, but about 3 to 6 months ideally, and lots of uncertainty in that, but then to see at which point we can actually get back to normal.
That idea of a long haul was echoed by Scotland's First Minister, Nicola Sturgeon.
13 weeks is likely to be the kind of period that we have to be prepared to have measures in place. Of course, we will continue to keep under review the type of measures, and we will not keep measures in place for any longer than we have to do.
Police in Bristol out reminding people to stay at home. And according to scientists advising the government, measures like this should stay in place until the virus really is under control.
Once we start to see a change in the trends and indeed a decrease in the numbers of cases, then we can have more confidence in the current measures having an effect. But what we need to remember is we need to allow this virus to decrease to low levels before these can be completely lifted.
All this on a painful day made worse by the loss of an ENT surgeon, Amged Al-Harani, confirmed to have died of COVID-19. He passed away at Glenfield Hospital in Leicester. He'd been volunteering in A&E. In a statement, his son Ashraf said, "Most of my dad's time was dedicated towards his family, and the rest of that time was dedicated towards his profession. He taught me the significance of respect and equality." We've had confirmation of the very sad death of an ENT surgeon, Amged Al-Harani. What do you think that says? What message does that send to NHS staff on the front line?
It clearly is a worrying event. It's worrying for the nation because it's another death in our statistics. It's another loss to a family, and it will be a loss to an NHS family as well.
And tonight, some more optimistic news about the NHS. 20,000 retired doctors and nurses have now offered to return to work, prompting this response from the Prime Minister.
One thing I think coronavirus crisis has already proved is that there really is such a thing as society.
Once again, a reminder of the incredible importance of everyone making an effort to stop the spread of the virus. A slow and difficult process. David Shukman, BBC News.
Our political correspondent Chris Mason joins me now. Chris, we got a clearer picture today, didn't we, of what the future might look like for us?
We did, yeah. We saw the Prime Minister there from his own self-isolation with the virus, sounding a little hoarse, a little coldy, but he was in a suit and tie. He's making the point that he's carrying on working and heaping praise on the country. Very striking phrase he used there. There is such a thing as society. He hasn't said that by accident. Margaret Thatcher back in 1987 said there was no such thing as society, although did go on to talk about the importance of families and the duties of looking after neighbours. The consistent message today has been that this is going to be a slog, up to potentially 6 months. That takes us till October. Now, Dr. Jenny Harris, England's Deputy Chief Medical Officer, was saying may not be as long as that. It may have to be a little further than that. And she did say, look, this isn't about necessarily keeping all of the measures that we've got used to in the last week in place for all of that time, but they'll have to be loosened ever so gently to ensure that when they are, there isn't suddenly a spike of cases a couple of weeks after that. The government, the scientists, they can't be specific. They say they're dealing with what they describe as a moving target. But what is clear now is that this is going to have profound implications for our way of life for a long time to come, for our businesses, our income, the education of our children, our capacity to move around the country, our ability to see our relatives. It's going to carry on for quite a while.
OK, Chris, many thanks. Chris Mason there. Councils and care providers have warned that supplies of personal protective equipment for social care staff are not reaching the front line. In a letter to the Health Secretary, two organisations say that some masks and gloves supplied to staff in care homes are dirty and damaged, while a major care provider has said its supplies are being diverted to the NHS. Our Home editor Mark Easton reports.
These are our masks that we're desperate for and hoping for a supply very soon. But as I say, our mask order has been delayed.
They're down to 1 or 2 days of protective masks at this extra care home in Northampton.
Eyes out, just been outside, there we go.
Supplies of hand gel are running low too. Desperate staff fear they won't be able to protect vulnerable residents from a virus that might well kill them.
The mask that we are using, we're not sure how to prioritise, you know, who has a mask first or which service user we go to that has a mask. So we're managing at the moment, but we don't know where our next supply would come from.
The company that runs this centre has repeatedly ordered new masks for their 2,000 carers across the UK, but suppliers have told them the protection equipment has been diverted to the NHS.
We're really down to the bare bones now of masks and gel in terms of supplies. And we're desperate really to try and get some more equipment through quickly so that our care staff can be fully protected and deliver the important service that they do.
The government says it's working around the clock to give the social care sector the equipment and support it needs. But English local authorities have written to the Health Secretary to say supplies are not reaching the front line. Councils across England are so worried about the shortage of masks for carers that they're appealing to closed nail bars, construction firms, anyone who's got supplies, to consider donating them to social services. Jamshal Ali died a few days ago after he tested positive for the virus in a London care home. Only a handful were able to attend his burial. The family say more should have been done to protect him.
Any family who has someone in a care setting really should make the effort of talking to the care home, really should find out what measures are in place so that their loved ones are being cared for.
Here's a drink for you, love.
Ash Karbi, who has Parkinson's and advanced dementia, needs carers 4 times a day at his home in North London. His wife says they arrive on public transport without masks to protect him or themselves.
They have to go within 2 metres of him, and there's no protection. They could be asymptomatic but contagious and give it to him. If he gets it, I doubt he'd survive, to be honest.
This is our dining room that has been tailored.
The government says every social care provider will get the supplies they need and denies the health service is being prioritised. But this is a sector that has long felt it's played second fiddle to the NHS. Mark Easton, BBC News.
And if you'd like a reminder of the restrictions that the government has introduced, you can find a full list of them on the BBC News website. And the head of Italy's coronavirus response team has told the BBC that there is now a severe shortage of medical staff in the north of the country, the area worst hit by the pandemic. Doctors and nurses from across Italy and around the world are being asked to volunteer to work there. There have now been almost 11,000 deaths from COVID-19 in Italy, with over 97,000 confirmed infections. Jean Mackenzie sent this report.
They've come from around the world to serve on the front line of this crisis. Doctors from Russia, Cuba and now Albania, and from every corner of Italy too.
I just finished from the hospital after 12 hours. I'm so tired.
Giuseppe's never worked in an emergency room. He only qualified last year, but he's left his home in Sicily for a field hospital at the epicentre.
Why did you decide to travel to work up here?
The emergency was here and it's still here, and so I'm here to get my contribution, my little contribution, and help my colleagues.
The force at which this virus struck the north of Italy has left it exposed. 300 doctors were flown in from different parts of the country last week, but this wasn't nearly enough. The situation in the north is so acute, so many doctors and nurses have fallen sick now that the government is appealing to people from all over the country to travel up there and help.
The north is still in a deep crisis. We have a shortage of specialized people in health sector because they have been contaminated. And so, of course, more of them now are observing a quarantine period.
With 4,000 nurses now infected, hundreds more are being drafted in over the next 2 days. Simona is one of them.
Mi aspetto che ci sia tanta sofferenza e tanto bisogno di supporto sia morale che professionale da parte dei pazienti che da parte del personale sanitario che è messo a dura prova.
The hospital is full and so crowded. All the people was hit by that virus like a train, like a tornado. It's terrible.
Tonight there's been an improvement. The rate of new infections and deaths is slightly down. But make no mistake, this country is still in crisis, with a long, hard fight ahead. Jean Mackenzie, BBC News, Rome.
Russia has become the latest country to close its borders to slow the spread of the coronavirus. The measures, which will come into force tomorrow, accompany a lockdown across Moscow, which will see residents confined to their homes. The capital has recorded 2/3 of the 1,500 cases across Russia, according to official figures. In Spain, the number of coronavirus fatalities rose by 838 overnight, marking the country's highest daily rise in deaths. Much of the country remains in lockdown. 6,500 people have now died from the virus there, and there are just under 80,000 confirmed infections. It's one of Europe's hardest hit countries, but Spanish health officials say the virus there could be near its peak. India's Prime Minister Narendra Modi has apologised to his country for the impact of a sweeping coronavirus lockdown. Tens of thousands of migrant labourers have been forced to return to their home villages following measures brought in at just 4 hours' notice. Mr Modi asked for forgiveness but said there was no other way to slow the spread of the virus. The US government's leading infectious disease expert, Dr. Anthony Fauci, says at least 100,000 Americans will be killed by the virus and possibly up to twice that number. Some cities, including New York, have warned that they may soon run out of medical supplies. Well, our North America editor John Sopel is at the White House for us. John, that's a very sobering figure.
Yeah, I think this will be a very salutary warning from Dr. Fauci, much respected. It's the first time I've heard an official give an estimate of likely death toll of between 1 and 200,000. And just to give you an idea of the scale of what's unfolding in America, the first death was just over a month ago. It took a month, 2 days ago, for it to reach 1,000 deaths. That has doubled in 48 hours, and that is the scale at which the death toll is rising from this. Now, there was a slither of good news out of New York where the governor there gave a briefing and said that the rate at which people are being admitted into hospital is slowing slightly, but this is the epicenter of the outbreak and it is still a very serious situation there. Donald Trump has abandoned his plans for imposing a quarantine on New York, New Jersey and Connecticut and just said that he'll issue a tougher travel advisory. He's due to give a news conference in the next 15 minutes or so. It'll be very interesting to see whether he accepts Dr. Fauci's assessment of the number of fatalities that coronavirus could bring.
John, thank you. John Sopel there.